Welcome to the channel The Indian Health Nerd, the authentic channel for health and medicine. Today, we will speak on the topic of digital eye strain, also known as computer vision syndrome. We'll speak about the symptoms of digital eye strain, what are the factors that lead to digital eye strain, is blue light responsible for causing digital eye strain, and finally, we'll touch on the point of the non-ocular manifestations of digital eye strain. The timestamps for these sections are given in the description and you can directly skip to the relevant part. So what is digital eye strain? Digital devices like computers, laptops, smartphones, tablets, e-readers and others have become an inseparable part of our lives. They have intruded our professional as well as our personal lives. However, prolonged use of these electronic gadgets can have negative effects on our health. One such effect of these digital devices is the computer vision syndrome or CVS. However, this term is not appropriate as the effects are not only due to computer but other digital devices as well. Another term used for this condition is the digital eye strain or DES. This term also fails to completely describe the condition. This is because although symptoms related to the eye are the most frequent, other systems like the musculoskeletal system can also be affected. The magnitude of this problem is huge. Two studies conducted in the UK and the US in 2016 found that adults typically spend around 5 hours on digital devices. Hence, this issue needs to be addressed on a priority basis. What are the symptoms of digital eye strain or computer vision syndrome? This is as per the American Optometric Association and Portello and colleagues in 2012. The symptoms can broadly be divided into two groups as suggested by the study of Sheedy and colleagues in 2003. Those that are related to excessive use of muscles involved in eye function and those related to the drying of the eyes. The symptoms related to excessive use of eye muscles are eye strain, discomfort or ache, eye fatigue or tired eyes, headache behind the eyes, blurred vision, and difficulty refocusing from one object to the other. Those related to the dry eyes are eye irritation or a burning sensation inside the eyes, excessive tearing, and redness of the eyes. These symptoms of computer vision syndrome are usually temporary and can be reduced by appropriate measures. What are the factors that lead to digital eye strain or computer vision syndrome, and how can they be corrected or minimized? The factors leading to this condition can be divided into three groups: personal factors, device-related factors, or environmental factors. Personal factors: eye muscle strain and fatigue. The first component involved in digital eye strain is the increased load on the muscles of the eye. This is because working on digital devices requires the eyes to focus for prolonged periods. To relieve eye strain and fatigue, the American Optometric Association advocates the 20-20-20 rule. As per this rule, it is advised to take a break of 20 seconds after every 20 minutes of working on digital devices to look at a distant object located 20 feet away. This intervention relaxes the muscles of the eye and reduces symptoms due to eye strain. It also gives the tired eyes a short period of rest. Infrequent blinking and incomplete blinks. Frequent and complete blinking of the eye is important as it spreads the film of tear throughout the outer surface of the eye. Tear performs important functions like preventing dryness of the eye, lubricating the eye as the eyelids move over the surface of the eye, preventing irritants to come in contact with the eye, and disinfecting the eye. Numerous studies like Nakamori and colleagues in 1997 and Patel and colleagues in 1991 and many more have found that people working on digital devices blink less frequently. Furthermore, studies by Chu and colleagues in 2014 and Argels and colleagues in 2015 found that digital devices users had more incomplete blinks. Both less frequent and incomplete blinking contribute to the symptoms of dry eyes. Lubricating eye drops can reduce symptoms due to infrequent and incomplete blinking. A study by Bhargava and colleagues in 2015 found that omega-3 fatty acids reduce the tear evaporation rate and improve the symptoms due to dry eyes. Blink training, that is to blink frequently and completely, given to users of digital devices may also help to reduce the symptoms due to dry eyes. Contact lens wear. Two studies by Toste and colleagues in 2014 and 16 found that digital eye strain symptoms were more common in contact lens users. Errors of refraction. Some people have pre-existing errors of refraction like myopia, also called nearsightedness, or hyperopia, also called farsightedness. Others have astigmatism, that is when the shape of the cornea or the lens is not perfect. The fourth condition is presbyopia, in which people more than 40 years of age gradually lose the ability to focus near objects. In all these four conditions, images are not focused properly on the retina. As a result, they experience symptoms like blurred vision. All these four conditions make the condition of digital eye strain worse. Hence, it is necessary to get the eyes checked for these conditions and first correct them if they are present. A study by Uchino and colleagues in 2013 found that dry eyes related symptoms were more common in people more than 30 years of age. 6. Two studies, one by Portello and colleagues in 2012 and the other by Dominguez and colleagues in 2014, showed that women more commonly had eye symptoms as compared to men. Another study by Uchino and colleagues in 2013 showed that women more commonly experienced symptoms related to dry eyes as compared to men. Nicotine use like smoking. A study by Dominguez and colleagues in 2014 also found a higher association of eye symptoms with nicotine use. Device-related factors. Digital monitor screen distance and placement. The distance and viewing angle of the monitor should be such that it should provide the most comfortable viewing experience with minimal eye strain. According to a study by Jasinski and colleagues in 1999, shorter viewing distance and higher monitor placement increases eye strain and consequently causes the eyes to tire much faster. According to this study, a monitor placed at a distance of 60 to 100 centimeters and at a vertical down gaze of 0 to minus 16 degrees was preferred by the participants in the study. Few studies have suggested optimal viewing distances for certain types of devices. A distance of 32.2 centimeters was recommended for smartphones according to a study by Babikova and colleagues in 2011. This is because smartphones have smaller font sizes and can be viewed comfortably only at shorter distances. For e-readers, a minimum of 50 centimeters was recommended in a study by Shi and colleagues in 2007. For computer monitors, optimum viewing distance of 50 to 63.5 centimeters was recommended by a study by Ancombe and colleagues in 1996. Keeping the monitor at a lower level than the eyes has another advantage. When the monitor is kept at the level of the eye, the eyelids are completely open and the entire surface of the eye is exposed. This causes the tear film to evaporate faster. However, when the monitor is kept at a slightly lower level than the eye, the eyelids partly cover the eye and the tear evaporation is slower. The next factor is screen resolution, background and text color, and font types and sizes. Low resolution screens increase the workload on the eyes. Viewing on high resolution screens is not only comfortable but provides an overall better viewing experience. There should be sufficient contrast between the text and the background color. If the contrast is not sufficient, eyes need to work that much harder to read the text. A good contrast is provided by a black text against a white background and vice versa. Certain font types like sans serif fonts are easier to read than serif fonts. Vertical fonts are easier to read than diagonal fonts. Smaller font sizes also put extra strain on the eyes. Environmental factors. As per a study by Sheedy and colleagues in 1992, environmental factors account for nearly a third of symptoms associated with digital eye strain. Reflections from the digital screen. Bright lights and various objects placed in the vicinity of the digital devices are reflected from the digital screens. This not only causes annoyance but increases the strain on the eyes. A study by Flynn and colleagues in 1999 found that anti-glare coating reduces these reflections and makes viewing more comfortable. Working hours. Long working hours led to more symptoms of digital eye strain according to a study by Dominguez and colleagues in 2014. In fact, the effect was found to worsen proportionately to the number of years involved on working on digital devices. Thus, a cumulative effect over many years was suggested by the study by Shima and colleagues in 1986. Surrounding temperature, humidity and air draft. Higher surrounding temperature, low humidity and high air draft can cause the tear film to evaporate much faster and worsen the symptoms due to dry eyes. Thus, these conditions can be optimized with moist and cool air to reduce dry eye symptoms. Does blue light contribute to digital eye strain or computer vision syndrome? Very few studies have been done trying to evaluate the role of blue light in digital eye strain. Most of the studies have been carried out on a small number of study participants. Hence, the results should be interpreted with caution. Of mention are studies by Isono and colleagues in 2013, Ide and colleagues in 2015, and Lin and colleagues in 2017, all of which suggest that blue light can contribute to the symptoms of digital eye strain. There is a separate video on blue light, and the link for the same can be seen in the description box. What are the common non-ocular symptoms, that is those unrelated to the eyes, seen in people working with digital devices? Neck pain, shoulder pain and back pain are commonly reported by those working on computers. Another condition is carpal tunnel syndrome. Carpal tunnel syndrome is seen in computer users. In carpal tunnel syndrome, the median nerve is compressed at the wrist joint. Symptoms may include tingling and numbness of the thumb and the index finger. There may be weakness of the hand and especially the thumb and the index fingers. A measure to reduce the occurrence of carpal tunnel syndrome is to provide adequate forearm support while using the mouse. Deep vein thrombosis. Prolonged sitting can reduce the circulation of blood in the veins of the legs and cause clot formation. This condition is known as deep vein thrombosis of the leg. The clot can then break and travel through the blood, that is to say that it can embolize and block the arteries of other organs like the lungs, sometimes even leading to death. Venous thrombosis can be prevented by getting up from the working place and taking a short walk every 30 to 60 minutes. To summarize, digital eye strain or computer vision syndrome is a common condition seen in people working with digital devices. Symptoms are those related to eye muscle strain and fatigue, like eye ache and tired eyes, headache behind the eyes, blurred vision, and difficulty focusing, and those related to drying of eyes, like eye irritation, excessive tearing, and redness of eyes. A number of factors are responsible for digital eye strain. These factors can be corrected or their effects can be minimized by measures like using the 20-20-20 rule, using lubricating eye drops, blink training, increasing intake of omega-3 fatty acids, avoiding use of contact lenses, correcting errors of refraction, reducing nicotine use, optimizing monitor distance and placement, increasing screen resolution, using good screen contrast, using certain type of fonts, avoiding small font size, using anti-glare coating on devices, and certain other measures. Thanks for listening. If you like this video, click the like button. If you want to watch many such videos in the future, subscribe to our channel. The links for the video on blue light is given in the description. Please check it out. Bye.